According to a recent Kaiser poll, 81% of Democrats favor Medicare for all, single-payer health care, along with 60% of independents and almost a third of Republicans. And for good reason. Virtually every country in the developed world provides better access to health care at half the cost using a single-payer system, or something very close to it. This is probably why presidential candidate Hillary Clinton has struggled to come up with an effective critique of her opponent Bernie Sanders' single-payer plan. She has resorted to poll-tested, conservative attacks, implying that single-payer represents a tax hike for working and middle-class families that would undermine their income.
And I'm the only candidate standing here tonight who has said, I will not raise taxes on the middle class. I want to raise incomes, not taxes.
At the most recent Democratic debate, Bernie Sanders had the opportunity to confront these accusations, setting the record straight.
Now, in your health care plan, the plan you released tonight, you would not only raise taxes on the wealthy. The details you released indicate you would raise taxes on the middle class also. Is that correct?
What is correct, and I'm disappointed that Secretary Clinton's campaign has made this criticism. It's a Republican criticism. Secretary Clinton does know a lot about health care. And she understands, I believe, that a Medicare for All single-payer program will substantially lower the cost of health care for middle-class families. So what we have got to acknowledge, and I hope the Secretary does, is we are doing away with private health insurance premiums. So instead of paying $10,000 to Blue Cross or Blue Shield, yes, some middle-class families would be paying slightly more in taxes, but the result would be that that middle-class family would be saving some $5,000 in health care costs. A little bit more in taxes, do away with private health insurance premiums. It's a pretty good deal.
Under H.R. 676, the single-payer bill in the House of Representatives, 95% of individuals would pay less than they do now for health care, and they'd receive treatment based on need, not on ability to pay. This is why it's disingenuous for Hillary Clinton to raise fears that single-payer would cut into working families' incomes through tax hikes. Clinton has been a tremendous leader in so many areas, including her successful efforts to pass the Children's Health Insurance Program in 1997. So join us in calling on Hillary Clinton to support a moral and sustainable vision for healthcare by supporting single-payer healthcare reform.